What is a vasectomy? A vasectomy is one of the most common contraceptive methods used today and is intended to be a permanent form of male birth control. It is safe, simple, and effective. But to understand how a vasectomy works, you first need to understand a little bit about your own anatomy. Sperm is made in your testes, and the average healthy male can produce millions of sperm each day. Mature sperm is stored in a sac called the epididymis, which is located right behind the testicle. During ejaculation, the sperm travels from the epididymis to the urethra through a tube known as the vas deferens. The vas deferens is the tube that is cut in order to prevent the sperm from being released. Therefore, it is called a vasectomy. Here are some important things to know about a vasectomy. First, a vasectomy does not affect the ability to have erections or orgasms. There is no change in sensation and no appreciable change in semen volume. A vasectomy does not cause health problems. Recent studies show no link with prostate cancer, heart disease, or other issues. The male sex drive remains intact. The male hormone, testosterone, remains the same after a vasectomy. Preparation for the vasectomy. In preparation for the vasectomy, all anticoagulants or blood thinners should be temporarily stopped, so no aspirin, ibuprofen, naproxen, fish oil, or vitamin E. You will need to shower on the day of your vasectomy. The scrotum should be thoroughly washed, and if recommended by your physician, hair should be shaved or clipped. If your physician has prescribed any medications, those should be taken prior to surgery. Also, be sure to bring snug briefs or an athletic supporter to wear after the surgery. Procedure. Prior to the surgery, the genital area will be washed with antibacterial soap and local anesthesia will be given to prevent any discomfort. After anesthesia is administered, a small incision or puncture is made and the vas deferens tube is pulled through it. The vas deferens tube can be cauterized, clipped, or sutured. The purpose of this method is to close and place a barrier between the two ends of the vas deferens and ensure a successful result. The surgical part of the procedure is generally fairly brief. After surgery, you will spend up to 30 minutes in recovery before being released. The local anesthetic will wear off in approximately an hour. So to aid in your recovery and comfort, stay off your feet and limit activity as much as possible for the first day or two in order to reduce swelling and bruising. Place a bag of ice around the area intermittently for 24 to 48 hours. Also, wait at least 2 days before showering. Avoid heavy lifting and strenuous activity for 1 week. Avoid intercourse for at least 1 week. Risks. As with any surgical procedure, there are risks, although rare, that can be associated with a vasectomy. 1% or less of patients get an infection. 1% or less of patients experience significant bruising and swelling, known as a hematoma. 1% or less of patients experience chronic or long-term scrotal pain. It is usually self-limiting and rarely requires additional surgery. If redness and drainage from the incision develop, or if fever or chills occur, contact your physician immediately. Follow-up. It's important to know that you are not immediately sterile following your procedure. As with any birth control method, vasectomy is not 100% reliable in preventing pregnancy. A reconnection of the vas deferens or recanalization during the healing process may occur in approximately 1% of men. Approximately 6 to 12 weeks following your vasectomy, you will need to provide a specimen of your semen for analysis. You will need to provide 2 negative specimen samples and practice alternate forms of birth control until cleared by your physician. Although most vasectomies are successful, there is a very small risk of pregnancy even after the semen analysis shows sterility. This has been estimated to occur in 1 out of 2,000 men. A vasectomy is designed to be a permanent form of male contraception, but there are options for fertility after a vasectomy. Although expensive and not always successful, vasectomy reversal or sperm retrieval with in vitro fertilization are available. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.